back in November, everything seemed to be slowing down. And I guess the city said, okay, we're done. They closed major locations where people were getting tested. So when Omicron came, we didn't have enough testing places. We didn't have enough testing vans, and it was really bad.
Good morning. This is Epicenter-NYC. We connect our communities to news, information, and each other. I'm Andrea Pineda-Salgado. Since the COVID-19 vaccine was first available to New Yorkers, we've been on the front lines helping our neighbors get their shots. We made appointments for restaurant workers in Harlem, taxi drivers in Brooklyn, grandparents in Queens, and even upstate farmers. But we quickly noticed that some communities had better access than others. So in September of 2021, we set up our first vaccine pop-up in Queens Village, one of the least vaccinated zip codes in the borough. By the end of day one, more than 60 people had been vaccinated. But eventually we saw what the rest of New York City was seeing: fewer and fewer people looking for a shot. And even though 75% of our neighbors received their initial doses, less than 40% have gotten their booster. Now, we're seeing a new wave of COVID-19 cases. So does this coincide with a spike in vaccinations? Today, Epicenter reporter Danille Hyams talks to Adriana Proano about the recent rise in cases, whether or not the city is prepared to provide testing for all who need it, and why incentives are a great way to get more of our neighbors protected. Adriana is the site supervisor for Epicenter-NYC in Queens Village. She's been on the ground since September of 2021, educating our neighbors and helping them get tested and vaccinated. To sum it up, she's worked tirelessly to move vaccination rates in the right direction.
So I wanted to chat today because, well, first of all, New York City just raised its COVID level, right?
Yes.
What does that mean, and how has it affected kind of what you're seeing on the ground?
So that means that we have waves, right? From what I was able to see in September, it was like a consistent number of people getting vaccinated and then also tested. But then when December came, it was a big increased for January and December. Now it went down, and now it seems like the curve is going up again. Of course, it's not as bad as it was back in December and January, and I think that's part of the city trying to get more testing locations and not closing the locations as what happened in November and December. So they have been keeping a consistent number of places where people can get tested so that we don't have big lines like the ones that we have in December. Mm-hmm. And also that those who are getting positive are not getting as affected as they were before. I believe from what the nurses are saying is that we don't see those cases ending up in a hospital. So it's not as bad.
And this latest uptick, is it a new variant or do we not know yet?
Well, from what I was told, it is a new variant. It's called BA2.
Okay. And we don't know a lot about it yet.
We don't know. The only thing that we know is that the city is getting ready. Back in November, everything seemed to be slowing down. And I guess the city said, okay, we're done. Okay, so we have gotten a lot of people vaccinated and everything is good now. So it's safe to close a lot of the site, a lot of the testing locations. So that's what they did. They closed major locations where people were getting tested. So when Omicron came, we didn't have enough testing places. We didn't have enough testing vans. We didn't have anything. So we had about 400 to 500 people getting tested on those small vans in Queens Village, and pretty much people going around looking for places to get tested, and they couldn't find any. Sometimes when they came to the locations that the city was sending them, we probably run out of supplies, and it was really bad. So what the city told me this last time is that they're trying to get ready for this new BA variant. So they already allocated their vans on vaccination and testing sites or trucks to the sites that they know are easier. And we're able to get the van for May, but they didn't have enough for May 8th. And they told me that was the reason why. But we actually got it. We had a confirmation today that we were able to get one. So we are covered for the month of May. And I think this is not because, as you said, we had an increase in cases. And the city now is trying to prepare. So they're trying to avoid the same mistake they did in November. But it's not that it's happening, not yet at least. And we don't know if it's going to be like that. But as of right now, I can tell you that the numbers are definitely increasing.
And what about boosters? I heard that the citywide booster rate is not so great.
For the longest, it was very slow. Like, a lot of people didn't believe on it anymore. I think a lot of people were very hesitant again. But the last 2 weekends, I saw an increase. And it's nice to see. So a lot of people, I don't know, maybe they were just waiting for the right time. It's very difficult to predict.
Okay. Do you think it's because of the new variant that people are starting to get COVID again? So is that kind of what you think is driving people to get their boosters?
I think that's one of the reasons. And the other reason also is, remember we had the incentive for the first booster. And that was ending in pretty much December and February. So we have to wait 4 months to get the second booster. So a lot of people, I think, are waiting for that time. And the other ones, I think, is because they want to make sure they don't get sick.
And will there be an incentive for the second booster?
No.
There's just an incentive for the first shot, right? Or was there also an incentive for the booster?
So there was an incentive for the first shot, and there was an incentive for the booster. The incentive for the booster, for the first booster, was very short. It was from December 15th to December 31st. And then they brought it back from February 12th to February 28th. And then they completely end the $100 incentive. A lot of the people who work for COVID-19 companies, I think they're trying to bring that back, but they can't. The city is saying they don't have money for the incentive. So I don't think they're going to bring that $100 incentive back. That would definitely bring the numbers up, but it's not happening.
Okay.
At least not now.
And what do people need right now? Do they need more tests? What is lacking?
I think the city, they're avoiding the same mistake that they did in November and December when we didn't have any. I believe that right now we have actually a lot. And they're being distributed pretty much everywhere. The schools, the jobs that are for the city, like nurses and everybody that is on the front line. And we are also given tests in the Queens Village community. So I don't think there's a surge right now for the take-home test. I believe the testing sites, they're still open. They're still trying to keep it open so that in case this variant causes the numbers to increase, they're prepared for people to go and get tested. But the hours are changing. I believe at this point they're doing the right thing. We will see if the numbers increase and if we are able to accommodate people. But as of right now, I think they're okay.
Those are all my questions. Is there anything else you wanted to share or you think people would find interesting about the current state of COVID-19 in New York City? I
really wish that we will get the $100 incentive back so that if those that were still hesitant or those that were waiting finally get vaccinated and that we are able to stop spreading the virus or at least are more prepared so that if new variants come, it doesn't get to the level that it was before so that not too many people die or so-called long COVID reaction.
Right.
So, we're all trying to do our best in this difficult situation.
Well, thank you so much for taking the time to chat with me.
I hope this was helpful.
It was very helpful. Thank you.
Whether or not the $100 incentive comes back, we need to continue to encourage and educate our neighbors on getting vaccinated and boosted, especially with the rising case counts. So if you or someone you know still needs a shot, let us help. We're here to help make the process as easy as possible. You can visit us at epicenter-nyc.com/vaccine-help to register or send us a note at vaccines@epicenter-nyc.com to learn more. Finally, before we go, a new weekly segment with our community manager focused on COVID-19 here in New York City.
On Monday, May 2nd, New York City raised its COVID alert from low to medium. A medium alert means that cases have surpassed a rate of 200 cases per 100,000 people in the 5 boroughs. According to the New York City Health Commissioner, Dr. Ashwin Vasan, the coming weeks are critical to slowing the spread of COVID-19 and getting back to a low-risk level so we can more safely enjoy our spring. He said now is the time to exercise caution, especially if you are immunocompromised. Specifically, he recommends that everyone wear a mask in public indoor settings, regardless of vaccination status. Vasan also reminded New Yorkers that, as a city, we have the tools we need to beat this virus. Tools like vaccines, testing, and masks. If you need help getting access to any of these tools, visit epicenter-nyc.com/vaccine-help or reach out to me directly at daniel@epicenter-nyc.com. Despite rising COVID-19 cases, the death rate continues to drop. More good news, there's no evidence that suggests the new variants are more vaccine resistant than previous variants. So getting vaccinated is still the best way to protect yourself from getting a severe case of COVID-19. And keep in mind, the vaccine's efficacy doesn't last forever. Right now, anyone 12 and over may be eligible for a Pfizer booster shot. So if you haven't already received yours, let us help. Again, visit epicenter-nyc.com/vaccine-help.
For more ways to get involved in your community, visit us at epicenter-nyc.com. That's all for today. Thanks for listening. And thanks for supporting us as we do our best to support our community. We couldn't do it without you. And if you're not already a member, sign up today by using the link in our show notes. Our intro music is All the Pretty Horses by Karavika. You can find more of their music on their website, linked to in our podcast description.